Today, we're going to talk about the threat and enforcement challenges of counterfeit medicines. If you don't think we have a big counterfeit medicine problem today, it's because you probably don't know that there are hundreds, if not thousands, of law enforcement agents all across this country working to keep them out of the drug supply and out of the country. Our guests today in this discussion are Steve Francis, a 20-plus year veteran of law enforcement and most recently the acting executive associate director for Homeland Security Investigations. It's the principal investigative component of the Department of Homeland Security before retiring just a few months ago. But in this role, Steve oversaw HSI's workforce of 10,000 employees assigned to 237 offices in 56 countries. They were charged to investigate, disrupt, and dismantle transnational criminal organizations that threaten or seek to exploit the customs laws of the U.S., especially those meant to protect public health and safety and secure global supply chains. Second, Michael Ball, the current Deputy Director for the National Intellectual Property Rights Coordination Center. In this position, he coordinates the federal government's response to global intellectual property theft and rights violations that jeopardize public health and safety. This includes combating the illegal import and sale of counterfeit or substandard pharmaceuticals and the illicit sale and distribution of unauthorized or counterfeit medicines and treatments. And I'm pleased to be joined today by Minnehaha County, South Dakota Sheriff Michael Milstead. He also serves as the vice chair of the National Sheriff's Association's Drug Enforcement Committee and on the executive board of the Midwest High-Intensity Drug Trafficking Area. In these roles, Sheriff Milstead has been intimately involved in going after criminal networks and has firsthand knowledge of the breadth and impacts of counterfeit goods on our communities. Thank you, gentlemen. All right, so there's a lot of news today about counterfeit pills ranging from blood thinners that we've covered to fake pills made with controlled substances like fentanyl, which has affected law enforcement in every town, city, and county and state throughout the country. First, I want to focus on the therapeutics or the counterfeits that do not include controlled substances that have been seized by the hardworking agents of Customs and Border Protection. And let's take a look at some of the results of these seizures now. And here, I just encourage you, if you want to talk about a specific thing that we're showing, just go ahead and jump in and just go ahead and comment. So let's start. So we've compiled a number of these. You know, it is not unusual that HSI seizes large amounts of counterfeit prescription medicine coming over the border from Mexico. And this is just a brief showing of what they had collected over a short period of time. And, you know, IPR Center does a great job, thanks to you, Mike, for the work that you cover in terms of coordinating things like Operation Interpol and then also sharing what you've captured. I think it helps raise awareness about the dangers of counterfeits online. For me, looking at this picture, all of these fake COVID tests, every single one you seized protected some patient from being infectious and maybe hurting someone else very seriously should they get a false negative.
Yeah, absolutely. I think that our relationships with all of our international partners, but particularly with Interpol during Operation Pangea, we're able to take some of the great lessons that we learn from doing our international and U.S.-based economic approach to intellectual property investigations, and then share that with our international partners.
And Pangea has been going on for 15 years. You guys have really learned how to make international cooperation an annual success story.
It is. Yeah, we run the operations center right out of Lyon, France, right out of Interpol headquarters. And not only does it help with that operation, but it's great to renew those relationships and sort of spread that out throughout the rest of the year as we move forward. So we have an excellent working relationship with Interpol and other members.
Well, we are looking forward to the results from 16, which I guess will come this year. A lot of people don't think about the fact that there's all these different ports of entry around the country, but CBP Cincinnati, I think, regularly publishes things. And we just had a trial here in San Francisco about a doctor who was injecting foreign, unapproved versions of Botox into patients, making about an extra $1 million from endangering her patients without telling them. And it's actually, this photo shows it's not an unusual thing for Customs and Border Protection to intercept cosmetic injectables that, for me, chills me to think that you'd inject something that you got from some random source, but it does seem to happen a lot. Let's take a look at another one. Obviously, Operation Stolen Promise, which was intercepting dangerous medical products during COVID, had a real resurgence, and we covered a lot of those in our videos, both unapproved and fake therapeutics, but also diagnostics, and then just outright counterfeit products. It was both heartening to see the law enforcement response, but disappointing to see the enthusiasm of the criminals for taking advantage of people during that time. All right.
Yeah, I think your point to, when we talk about the counterfeit injectables for cosmetic surgery, and the same thing that we saw with COVID, and the counterfeit masks, the counterfeit PPE. If criminals can make money off of it, they're going to make money off of it, and I'm sure we'll talk about that more in depth as we go on. But just that lack of concern, compassion of anything. When we're talking about things that we'll talk about a little bit later, like counterfeit oncology drugs, counterfeit HIV medications, that they have no problem counterfeiting anything.
Yeah, it's very scary.
And Shabbir, if I can comment a little bit about Operation Stolen Promise as well. I think what was really significant and impactful when we launched Operation Stolen Promise in April of 2020 is that it was, a worldwide, pandemic. There was a lot of, there was a global threat to consumers. And the best, I think, part of what happened with launching that initiative was, getting everyone together, both, the state, local, federal, international cooperation, the private-public partnership. I think that really contributed to the results of the success in interdicting, seizing and then investigating and prosecuting a lot of these illegal importation or substandard or hazardous goods coming to the United States. And you see the 1 million fake products up there now, the virus shut out, this before the rollout of the vaccine, but it was impactful because, there's just collaboration across the globe in a very meaningful way. And it was probably the first time I've ever seen everyone coming together to combat that threat.
If I could comment maybe from a local law enforcement perspective too, what happens when these products enter the supply chain in the U.S., come from overseas, maybe a heart medicine, could be a cancer drug. What happens when they enter the supply chain here? Quite frankly, on local law enforcement side, any effort to keep the drug supply safe has to happen at the front end. If they don't come through the pharmacy, of course, we're regularly promoting because of on the illicit drug side, fentanyl. We're regularly saying if your pills aren't coming from your local pharmacist, they could kill you. And on the other side, when you're talking about heart medicines, cancer drugs that maybe a family member is purchasing overseas because they think, they're getting it cheaper. Well, if that doesn't come through, through the FDA, through a pharmacy, local law enforcement typically wouldn't have any idea if the medicine that they were taking to fight cancer or to deal with their heart issue was legitimate or not. We're not trained in that. And then in those cases, oftentimes we're just instructed to have the person taken to the funeral home for the funeral. And so any effort to keep our supply chain safe has got to be on the front end. Even our coroners, if they have an individual that for some reason they have come to them, they may do a tox screen, but certainly cancer drugs, heart medicines, they wouldn't be in that tox screen anyway. So I don't even know what they would screen for if they wanted to try to identify this person was taking a medicine that really wasn't a medicine. Maybe it was a counterfeit. So the fact that we view the importance of a safe supply chain into the U.S., it needs to flow through the same inspection process that our local pharmaceuticals do, or please don't expect that the police officers are going to CSI and have some magic way to determine that this cancer drug was really just sugar tablets or something that was counterfeited and imported into the U.S. So that certainly is something I think we all have to be aware of.
Sure. If you bring up a really interesting point, which is, while we've talked a lot over the last 5 to 10 years about doing tox screens for things like fentanyl to determine cause of death, someone who's been taking a sugar pill that's supposed to be an oncology medicine, there's no way a sheriff's deputy is going to know what that is.
Absolutely correct.
And I don't even know how you tox screen for that, because you're tox screening for the absence of a chemical, and it's just going to look like it was the cancer that killed them.
And there likely wouldn't even be a tox screen, because if it's a chronic health issue and the person passed away, there's probably likely going to be just a funeral.
What is the current threat picture of counterfeit medicines to consumers? Like, where do they come from, and how do you think they get into the country now?
Yeah, look, I mean, the threat picture of counterfeit medicine to the U.S. consumer is significant, right? It's a huge public safety and health concern. We see, and we've seen the last couple of years, right, over 100,000 overdose drug deaths, according to the World Health Organization, right, over 1 million deaths annually related to counterfeit medicines and drugs. The threat is real, right? We see that many of these products come in and look like they're legitimate. The packaging, the pills, it's almost impossible to detect or determine which ones are counterfeit. And then, of course, I think it's the convenience of what's happening, right? We saw the significant increase of online shopping during the pandemic, but now the convenience of having, purchasing pills or medicines online. We're seeing, tens, if not 20,000 people visiting these sites each and every day. And these are fraudulent sites where people can purchase and are purchasing products and ingesting them. And unfortunately, there's tragic circumstances to that. So it's been, crazy health and safety threat ever since, I think the last 5 or 10 years as it relates to counterfeit medicines. To the extent, as we're talking about like law enforcement, kind of cooperating and collaborating, CBP just last fiscal year, over 66% of their products that were seized were health and safety products, followed by electronics by 14%. But that being said, right, we know it's a whole government approach, right? There's no way one entity can do it. Law enforcement can't do it alone. When you look at, what's important now to kind of combat this threat is, collectively working at and looking at FDA policies and, of course, regulations, CBP's efforts in inspecting and detaining and then seizing products. The global footprint that Homeland Security investigations have, right, where health and safety is always a top priority for the agency, and now having that global footprint, being in over 70 countries around the globe, over 7,000 special agents operating around the world. What's also another important piece to this is working with our state and local partners in getting effective prosecutions done, right? Whether it's at a state, local, federal level, working with the Department of Justice on these efforts. And we're seeing some significant indictments in the last few days, so they're pretty powerful. That we just heard a big announcement by Attorney General Garland on 8 Chinese nationals that were indicted, and that global reach and that impact and education around that, I think, is very important. And of course, the private sector plays such a critical role in all of this, right? Because most of the information that we get, at least during my time at that National IPR Center, was the private sector sharing their information and data on harmful products being really infringing on their intellectual property and being shared with us. I think that was a very, very important piece to the work and the puzzle that we're doing. Where are these products coming from? I think, the number one source country is India, followed by, China, Hong Kong, Turkey. We're seeing many of these countries as being source countries that really are having a significant impact on the health and safety of the American public.
You led me into a really interesting question, which is, you talked about the countries from where these counterfeits are coming from, like India, China, Turkey. These are also countries which make our medicine. And I have heard people say, well, much of our medicine is made in that country, so why is it unsafe for me to go online and order? But what you're telling me is that there's enormous hundreds of pounds a day of dangerous medicine that comes into this country from that place. So clearly, just because some medicine is made there doesn't make it all safe.
Yeah, absolutely. And I think, the medicines that are diverted, or the ones that don't have the active ingredients, and the ones that are, harmful, are, also kind of getting into the secure supply chain where the legitimate medicines are. And I think what's happening now is, of course, everyone's looking for an opportunity to profit from this. And that's really the challenge that we're faced with, right? Is that unfortunately, some of these medicines are also, touching or, impacting our legitimate supply chain. And through these source countries, a lot of the stuff is being diverted to other countries and ultimately on online marketplaces where people unfortunately don't know the circumstances or believe that there are legitimate online pharmacies that are purchasing these products and dealing with the consequences of not getting an FDA approved drug within the United States.
So I want to turn next to you, Director Ball. You've had a distinguished career at Homeland Security Investigations, and you're now a leader at the IPR Center. I also know that you used to be a special agent with Health and Human Services. So you've got a pretty broad perspective on counterfeit medicines more than most people. So what is the IPR Center's current focus when it comes to counterfeit medicines, and what threats do you see that you are working on making sure are attacked?
We have three pillars here at the IPR Center that we apply towards counterfeits across the board: interdiction, investigation, and training. And we're doing the same thing here with our counterfeit pharmaceuticals. So from an interdiction standpoint, those are our CBP partners. At the IPR Center is comprised of HSI special agents, FBI special agents, and CBP officers, and then 30 plus partners of industry, academia, and primarily other federal law enforcement. So bringing that to bear on the interdiction portion, that's where we encourage all of the U.S. companies that are producing some sort of product, whether it's produced overseas or produced domestically, to register with CBP. So if they register their product with CBP, CBP not only has a forward-facing portion where they're the registry of the design of the packages and the copyright material, but then there's also a law enforcement only portion where there are some possible packaging, some watermarks, holograms, all kinds of different things that can be put on, where CBP has access to that, of course, keeps that private, but is able to look at the different shipments and things that are coming in. And then from it, go ahead.
I was going to say, I actually was privileged enough to participate in a training doing some education about counterfeit cases we followed for CBP agents that worked both ports of entry on the East Coast and the Midwest, and then also on the Mexican border. And we spent all day, and I watched these guys absorb what I thought was an unimaginable amount of information about different products. And that was just medical products day. Like the amount of information that they have to learn to be able to pull stuff out of the mail stream and look at it and identify counterfeit products, I thought was incredibly impressive. This is not just an open box and then look along job. Like there's a lot of knowledge you have to hold in your head so that you can actually understand what it is you're looking at and what are the signs of a counterfeit. It was very impressive to me.
Yeah, absolutely. But that's where that partnerships come in. Because on every product, every company, everything that's registered with CBP, both through their system and then they hear through the IPR Center, there's a point of contact from industry, because none of those officers are going to be able to retain everything. If it's not in the system or something seems a little off, and frankly, to your earlier discussion with Steve about the source countries, we find that across the board, that the primary company or the primary countries where any product is counterfeited is a country where that product is produced. Doesn't mean that others don't. It just means that you have the talent of people that may have worked in those facilities. They may have access to some of the information about how to counterfeit. My point is that they get more and more sophisticated in being able to counter the security measures and things that are on package, especially in the profit margins you're talking about with counterfeit pharmaceuticals. So that it's very important for industry to be connected both with CBP and their online registration system and the IPR Center. So an officer in Cincinnati opens a box, thinks they're looking at something legitimate, probably not. Something tips them. They have a person that they can call. We can immediately get them in charge with the expert, whether that's somebody from Louis Vuitton or that's somebody from Pfizer, right? That they can dial right in and say, look at the box, flip it over, peel back this piece. Does it have anything there? Right? So that's why those partnerships become so important. And then on the investigative side, that's where those partnerships kind of are taken to the next level.
So that's the good, the cooperation, the training, the participation of both public and private partnership there. What are the challenges you still face in trying to catch and protect Americans from incoming counterfeit medicines?
Big challenge. Probably the biggest, and I'm sure that the sheriff is well aware of this with his encounters with the international mail facilities, is what CBP and law enforcement call the minimus packages, where the days of huge shipping containers full of counterfeit items that we're able to seize have gone relatively by the wayside. We still get those because if one is missed, that's a big payday for these transnational criminal organizations. But we're talking about de minimis packages, meaning like they're just flooding these mail facilities with small packages with small quantities that it would be impossible for everyone to check. And then with personal use exceptions for medications ordered abroad by FDA, some of these things go directly through. So there is sort of like death of a thousand cuts. The next thing we're facing is the ones who are doing these shipments. A lot of people might think that some of this might be mom and pop things, or maybe this small criminal organization in a foreign country. The word that we use is polycriminality. Criminal organizations aren't out there for a specific target. Drug cartels in Mexico are a good example. They're not thinking, boy, we really want to make our money on drugs. They want to make money. So the drug cartels are getting into shipping counterfeit pharmaceuticals, counterfeit luxury goods, counterfeit everything. So the challenge we have is these are transnational criminal organizations, sometimes large, sometimes state-sponsored criminal organizations that are shipping and counterfeiting these counterfeit pharmaceuticals and medical devices, and their level of funding and sophistication to be able to do that is sometimes significant.
Well, let's actually take that a step further, which is that, I've seen people say that counterfeiters can't copy blister packs and they can't do like foil seals on bottles or fake hologram stickers, which I saw on fake N95 masks that CBP intercepted. So have you ever seen an unbeatable security feature like that? Or are criminals just so motivated and make so much money from fake medicines that they have the money to be able to do this stuff?
Yeah, to answer your question, nothing is foolproof. And whether it's a blister pack or it's some sort of holographic, even some radio tracking mechanisms that are put into larger shipments can all be circumvented. Wow. So that is why those partnerships that Steve talked about earlier are so important, because it is a game sometimes of whack-a-mole, of us having to stay one step above. And that's what we communicate to all of our partners and all of our pharmaceutical and medical device and all of the producer partners know full well that they are in a constant state of keeping those security features updated and trying to stay ahead, because these organizations not only make a lot of money, but they're well funded because many of them are part of large transnational criminal organizations.
They're so difficult to identify whether they're counterfeit from the packaging that many of these products need to go to, the labs to actually test to see if the active ingredients are in them. So we hear a lot of this from the private sector investigative capabilities that when they're doing control purchases, it's almost impossible to determine whether or not these are legitimate or illegitimate. And then working with the private sector, the manufacturers would need to go into their labs to determine whether or not they were actually counterfeit.
That says to me that it's almost impossible. If a CBP agent who does this for a living has to call, phone a friend to call an expert manufacturer, that means that I, as an average American, have no chance of being able to look at a counterfeit and being able to tell if it's real or not.
I think that's accurate. Absolutely.
I'm going to move on. We actually talked a great deal about that. I want to show this slide from Scott Gottlieb of his photos from the IMF. Steve or Mike, former FTC Commissioner Gottlieb really blew my mind when he tweeted out these photos of dangerous, substandard, counterfeit medical products that had been pulled out of the mail stream by hardworking agents, and it was the volume that really struck me. Can you give us a sense of just how much of this comes out on a regular basis of the mail stream that would otherwise go to Americans and hurt them either in lack of treatment or because it has toxic ingredients?
Yeah, I'll just jump in. A few years ago, I actually had an opportunity to visit an international mail facility at JFK and to see, and I think this picture actually gives a very good description of what you're seeing every day. I think over 1 million packages or close to 1 million packages come through the IMF, the busiest in the world. And, the CBP officers, the frontline officers have to determine which ones have illicit products in them. And, they're focused on either intelligence, where that information is being shared with them by the private sector, to inspect certain packages, of course, and other aspects of the National Targeting Center, where they have the ability to identify some packages to have some intelligence-driven operations. In other areas, the non-intrusive inspections, this is where, you get some help from some canines and other techniques to determine whether or not these packages are actually legitimate or have, fentanyl or other drugs in them. And then lastly, the end inspection, right, which is a very difficult task to open and inspect these packages on a day-to-day basis. But I do think that photo kind of reminds me of a lot of the visit there and really the daunting task, right, that these CBP officers have each and every day. But they have a pretty remarkable, enforcement operations that are done every day there. So, kudos to the work that they do there at the IMF. But clearly, right, when you look at the overdose deaths in the United States and all the illicit products, coming in and out, it's just one IMF out of, I believe, 9 worldwide across the United States that have a very challenging task. And I think that that picture does a lot in explaining what they have to deal with.
And to build on what Steve's talking about, the volume is driven by U.S. consumers. If people weren't purchasing it, it wouldn't be coming in that volume. So we talked about threats a little earlier. The proliferation of being able to order medications that wasn't prescribed by a doctor and that you're not picking up at your pharmacy, like the sheriff had mentioned earlier, where you can buy it off possibly illegitimate online pharmacies, clicking on links that may or may not be legitimate on e-commerce platforms or on social media, and people looking to save some money by buying these prescriptions or buying this medication either legitimately or what they believe to be legitimately or through some of the marketplaces that are illegitimate is what's driving the volume of this traffic. And it is a very large volume.
Knowing the harm that you've seen in images like this, what was your number one advice you'd give Americans to steer clear of counterfeit medicines?
Go through your doctor and buy it at a legitimate pharmacy.
Yeah, the internet's not the bargain, it seems. All right. So we've talked a lot about counterfeit interdiction as these products enter the country. But as we talked about before, much of the shipments make it past the border. And if a patient or many patients get hurt, they're probably going to call emergency services, which it's now a local law enforcement problem. So let me turn to you, Sheriff. You've not only served in law enforcement for over 40 years in South Dakota, but you also lead the Drug Enforcement Committee at the National Sheriff's Association. And while non-opioid counterfeit medicines are a big safety risk for consumers, fake pills made with controlled substances, especially fentanyl, are their own mountain of a problem that I don't think any town has been untouched by over the past 8 years. And the DEA just last week announced that they'd seized 55 million fake pills made with fentanyl just this year alone, which surpassed this point last year, which was 51 million pills. So that's a big number. I don't think that we can appreciate that. Can you help me put some local context around the growth in this harm? And how does this mountain of fake pills affect your operations in South Dakota?
Well, we've never seen the prevalence of counterfeit medicine or these counterfeit pills in America like we've seen today. One of the things that really interesting about the DEA's release, and we work with Administrator Milgram on jointly doing a news release to try to get that extra number of voices out there, America's sheriffs, 3,200 of them saying, Look, not only are the seizure numbers just off the charts, but in the last seizures, DEA is reporting 6 out of 10 of the pills they were seizing have lethal doses of fentanyl in them. And so it's, you have a much better chance at Russian roulette than you do with these pills that are coming across our border. And so as these counterfeit pills or the raw fentanyl crosses the border, it's one of two things is going to happen. If it's not already pressed into pills, likely in the southwest part of the U.S., it'll be pressed into counterfeit pills. There was a day when in the drug unit that I supervised before I was the sheriff, there was a day where we kept the PDR, physician's desk reference, on our desk so we could go through the pictures of pills and try to see what we were seizing. That's worthless to us right now because they can make these fentanyl pills lethal doses into any pill you want, whether that looks like an aspirin or an oxycodone M30, whether it looks like Adderall, whatever it may be. They counterfeit anything. So when we encounter pills on the scene of these overdose deaths, which we're doing regularly in America and in my own jurisdiction, we don't know what that pill contains. We don't know what the dose is. The interesting thing that's happened is that just in the last 2 years, we've seen the shipment of these pills probably go tenfold what it used to be, using common carriers like U.S. Postal Service, using UPS, using FedEx, using those carriers to ship that. Now, they're not shipping it to us from Mexico because that would likely be intercepted by the good work of our federal partners. But the reality is once it enters the U.S., which it's entering at an unprecedented rate, they're shipping it across America. They're choosing that instead of using a mule, renting a car, sending somebody across with a trunk load, because they were being intercepted too often. So the drug cartels are now utilizing, our shippers to do it. And whether that's a kilo of fentanyl or it's 1,000 or 10,000 pills, they ship it much easier that way. They reduce their risk. They reduce their expense. They can ship it for maybe $100. And it goes actually to the dealers. The cartels are still shipping to the dealers. Now, those dealers, either they're distributing that into their local network, or they're also shipping it out to more individuals through the dark web or through other online illegitimate sites. So it's I never get invited to talk to the Optimist Club anymore when I'm talking about this. It's the reality is we're just, even when you talk about parcel interdictions, what's coming through our carriers, we're just, even with our federal partners, we're just scratching the tip of the iceberg. There is so much of it flowing, up to 80% flowing through the carriers now, that it's very difficult for us to intercept, and it's very high risk to the people in America. I see it in my own jurisdiction. I've lost friends, have lost their children to this, not intentionally. They're not trying to kill themselves, but somebody found or somebody got a particular prescription drug, and they use it and they die. And it's just like it was mentioned earlier in this discussion that some of these pills that are legitimate in one country are also illegitimate. Well, the classic example in my jurisdiction would be M30s. There's people who take oxycodone, and it's very important for the treatment of pain in their situation. But most of the M30s in my community are counterfeit M30s, and they're extremely difficult for a trained law enforcement officer to tell the difference. More or less, a patient that thinks they're getting legitimate M30 and they die of a fentanyl overdose.
Yeah. I think about all the things that have affected and changed your job over the past 8 years with the rise of counterfeit pills. And it's staggering to me, as someone who's not even in law enforcement, looking at it from the outside, the fact that you now carry medicine, Narcan, and that you are expected to administer it. The stories I hear about constant calls that local law enforcement have to respond to because there's so many overdose deaths, more than there used to be, because of what Steve said about 6 and 10 pills having too much fentanyl in them. I imagine that you are very sensitive to what happens in the world of federal policy that might make your workload for that worse, right? And you are very clear about talking to federal policymakers about not making it worse or doing things to make it better. If the drug supply was expanded to include even more medicine from sketchy sources like these non-opioid counterfeit medicines we're concerned about, would that really, really strain your department's ability to function?
Well, it would. And I think, the entire National Sheriff's Association made a strong resolution about this just recently. And I think it's important to realize the key part of what we said about that issue is that if they're going to do that, if they're considering that they have to put in rules and regulations, including robust inspection and quality control authority, budget, and resources for the FDA. That's not going to happen at the level that it would have to happen to make that safe. The reality is, what authority does the FDA have over a drug manufacturer in Turkey? What if they're shipping drugs to us from Turkey, and if they're doing that under this umbrella, what regulation authority or power does the FDA have over a foreign company? And then when it comes into the U.S., how does it come in? Does it just get shipped to the consumer? Does it get shipped to an FDA testing site? Is the FDA sufficiently resourced with people and equipment to be able to guarantee to the American public that is a legitimate medication to be able to be distributed through pharmacies? If you circumvent all that, then you no longer have a safe supply of drugs in the country.
Yeah, and it's interesting. A state has applied to do this kind of foreign importation of drugs from wholesalers that are not on U.S. soil. So it trips your concern about what regulatory authority do we have over them. And the FDA basically confirmed that NSA's concerns about safety were true. And they wrote in a letter back in August, and they told the supplying state that we're concerned that you don't have the security procedures in place. Exactly what you were saying, Sheriff. We're concerned that you don't have a testing process in place that will keep us safe. And I think the end of that sentence is, and you're going to make the problem worse for law enforcement. And I think it's fair to ask you this question now, which is, if under one of these programs, a cache of fake blood thinners or fake oncology medicine showed up in your county, and you started getting calls about people dying, would you even know that that's what you had? Are you resourced for that?
No. I mean, the reality is, in America, 18,000 law enforcement agencies, 85% of them are 20 or fewer officers. Even in the large departments, would you have the ability to recognize that somebody with a chronic health problem who passes away, we wouldn't be able to identify if the pills that they were taking were sugar, or if they had a toxic subject or substance, or if they were real or fake. I mean, how would we know that? And if you flood the market that way, please don't put it on the police to expect that we really have this magical lab that we can test anything. Our toxicology panels are specific to drugs that are in our market. They're not specific to say, is this really a good, legitimate cancer drug? So anything like this has to be done before it ever hits the marketplace, before it ever hits our drug supply. So that's why, as sheriffs, we said there has to be a robust authority and way that the FDA can examine these to guarantee that they're a safe medicine. If they aren't able to do that, then how do you open that door? I am like other Americans. I'd love to have, less expensive pharmaceuticals, but if they're not safe and we don't know that they're safe, I don't want anything to do with them.
And given our experience over the last 8 years with perfect looking fake deadly pills, it doesn't suggest that we're in a position to be able to screen that kind of stuff out.
It is really a bad timing.
I want to talk, though, not about the specifics of the case, but about the challenges of prosecuting people in foreign countries. And I think that a lot of Americans who are not familiar with the process of extradition think that we just make a phone call to a country in Eastern Europe and ask, Red Rover, can you send these two criminals over? But it's actually a lot harder than that, isn't it?
It is. It is. And I can tell you that not every country has the same relationship with the United States, whether it comes to interdiction. But I can tell you that law enforcement in a lot of different countries have the same goals, and we get along, whether it's through Interpol or Europol or Five Eyes relationships or the different things that we're doing.
There have been, and you have seen up close, this high proliferation of foreign drug sellers. CBP agents have faithfully pulled hundreds of pounds a week of their dangerous products out of the mail stream, and many of them probably don't ever face justice for their crimes of endangering Americans and defrauding them. Do you have concerns about policy proposals to widen more access of Americans to unsafe sources through like foreign drug importation as a result of that experience?
Yeah, absolutely. I mean, I'm always, I think, very in favor of any policy that's going to bring accountability, liability, right, and transparency to what's happening. I mean, we're dealing with an unprecedented epidemic that continues to worsen year after year. And I do believe, right, policies have to change. There has to be some consequences, whether it's social media platforms, whether it's foreign sellers, right? Any one that's somehow, some way contributing to these overdose deaths, the counterfeit goods that are coming into the United States that are impacting health and safety. So I'm a huge advocate for anything that we can do, right? That's going to bring a lot more transparency and accountability to what's happening today.
And the opposite is true. Policies that weaken our supply chain are definitely not welcome at this point.
Not welcome. No, this is not the time.
All right. Well, thank you, gentlemen. It's been a pleasure. You have a wealth of untold experience, probably 140 years of combined experience at this point. And I'm grateful for your time spending with us today. And thank you, and be safe.